Hello.
Ah,
Okay, now you can start. Uh, uh, Good morning, everyone. Myself, Krishna Limbacha. I am working as assistant professor in instrumentation and control department of Parul University. Here, I am glad to inform that Parul University is completely digital university nowadays. Faculty members of Parul University are in contact continuously to the students by online lectures and online tests, exams, as well as online webinars. Um, Today, we are going for the webinar entitled with psychiatric aspects of coronavirus. I am just giving brief introduction about the speaker, Dr. Hardik V. Patel. He completed his psychiatric study through Cooper Medical College, Mumbai, and currently he is working as psychiatric consultant at LG Medical College, Ahmedabad. Recently, he cracked that phase 1 exam of psychiatric study, that is UK based exam. So, I am congratulating Dr. Hardik, and I am forwarding this webinar to Dr. Hardik. Now, you can start this webinar. Thank you.
hello everyone. Am I visible?
Hello.
Ah,
You can start. Okay. All
am I vis-
faculties and other people are connected through online webinar. Now you can start. Okay.
am I visible? Am I audible?
Yes, you are visible and audible, as well as your presentation file is on the screen.
Okay. Hello everyone. This is Dr. Hardik V. Patel. I have done my DNP psychiatry from Dr. R.N. Kapoor Hospital, Mumbai. I am currently working as a senior resident in psychiatry department at LG Medical College, Ahmedabad. Today my lecture is on psychiatric aspect of coronavirus. So let's begin it. So, as everyone knows, today is 1st May. On this day, around 60 years back in 1960, Gujarat and Maharashtra state were formed. So happy Gujarat Day, happy Maharashtra Day to all those who are seeing this lecture. Let's start today's lecture with saying Jai Jai Garve Gujarat, Jai Maharashtra and Jai Maharashtra. Outline of today's lecture include few facts about coronavirus. Then after we will talk about major psychiatric illnesses which are emerging out during this pandemic. Then after we will talk about psychosocial vulnerability, which means people who are at risk to develop psychiatric illnesses. Then after we will talk about etiological factor responsible for major psychiatric illnesses. And at last we will talk about how to reduce stress, what step we should take to reduce stress. So let's start with coronavirus. Till now, we have read many things about coronavirus, but there are few facts you have to know. The first thing which you should know is that you should able to differentiate between the symptoms of coronavirus and symptoms of uh, common cold. Coronavirus rarely cause runny nose, sneezing, and sore throat. These are the symptoms mainly found in corona, mainly found in a common cold. However, in 5% people have no. However, in the 5% of patient having a coronavirus have these symptoms. But if you have any of these symptoms, you should visit physician nearby. Don't be a Google psychiatrist, Google doctor at home. Be a responsible citizen. Do not hide your symptoms to your physician. You should tell everything you are suffering from. Another thing which you should know is 80% coronavirus infection are mild in nature. They are like just a few and you can recover at home. 13 to 40% infection are severe in nature which leads to development pneumonia and shortness of breath. 4 to 5% infection are critical in nature which leads to a development of acute respiratory distress syndrome, septic shock and multi-organ failure. WHO has given mortality rate about coronavirus, which is around 3 to 4%. So look at this slide. This is like a game of numbers. We as a human have tendency to notice negative first. We notice that 14 infection are severe in nature, 4 to 5% infection are critical in nature, but we don't see that 80% infection are mild in nature. We see that 3 to 4% people would die because of coronavirus, but we haven't noticed that 96 to 97% people would survive as well. So if you think in this manner, your anxiety will be less. So as we all know, we are human beings. We have emotions, and our emotions do change with the circumstances. And by seeing current circumstances, it is okay to feel anxious, stressed, or depressed sometimes. Uh, so if you have symptoms of anxiety or depressions for few hours for 1 to 2 days, it doesn't mean that you have anxiety or depressions. So the question would arise when to call it as a psychiatric illnesses. So most of psychiatric illnesses which leads to a psychosocial occupational impairment. So what does it mean by psychosocial occupational impairment? So most of psychiatric illness leads to psychiatric, social and occupational impairment by having the symptoms of depression and anxiety. You feel tired. Uh, it leads to difficulty in maintaining social relationship and the work output because of the psychiatric illness at the lesser side. What are the psychiatric illnesses which are emerging out? So it includes depression, anxiety spectrum disorder, obsessive-compulsive disorder, post-traumatic stress disorder, psychotic spectrum disorder. Let's talk each of them separately. So first of all, we would like to talk about depression, it is second leading cause of disability worldwide. The prevalence of depression it is 12%. It means out of 100%, 12% people is suffering from depression. So you can imagine how common it is. The minimal duration of the symptoms required to diagnose as depression is 2 weeks. What are the symptoms of depression? Symptoms of depression include cardinal symptoms and additional symptoms. Cardinal symptoms include depressed mood or sad mood, which is definitely abnormal for the individual present for the most of the day and almost every day for at least 2 weeks. Another cardinal symptoms is loss of interest or decreased interest in previously visible activity. What does it mean? So it is like before starting of depression, patient used to like drawing, dancing, singing. He used to like going out with a friend. But after starting of depression, patient doesn't have interest in these activities. The third cardinal symptoms is decreased energy or easy fatigability. It means patient has easy fatigability with a little work. Additional symptoms include loss of confidence and self-esteem, excessive and inappropriate guilt and feeling of self-reproach. It means that the patient feel because of him, everyone has to sit down. Recurrent thought of suicide and suicidal act. Patient has difficulty in concentration. Patient has psychomotor activity like increased psychomotor activity or decreased psychomotor activity. Increased psychomotor activity also called as agitation, and decreased psychomotor activity also as psychomotor retardation. Patient doesn't go out of his bed or his room for a prolonged period of time. It also includes sleep disturbances of any time. It means patient has difficulty in initiation and maintenance of the sleep. It also leads to a change in appetite, either increase in appetite or decrease in appetite. So if patient has two cardinal symptoms and two additional symptoms, it is called as mild depression. It doesn't require psychotropic medication. Patient may improve after taking a cognitive behavior therapy. If cardinal symptoms are two and additional symptoms are three, then it is called as a moderate depression. It requires antidepressant medication. If patient has three cardinal symptoms and four or five additional symptoms, then it is called as a severe depressive episode, which required antidepressant medication for at least 6 to 8 weeks, 6 to 8 months. Next, we will talk about anxiety spectrum disorder. It is seventh leading cause of disability. 12-month prevalence is around 70.7%. Anxiety means fear without an apparent cause. So, if we see this definition in current scenario, that some of the patient which is coming to our OPD saying that they have coronavirus infection, when we asked, did you visit any out of country? Did you visit any country recently? They said no. When we asked, have you come across to some coronavirus positive patient? They said no. But still, they have a repeated breathlessness and anxiety. So this can be a part of anxiety spectrum disorder. Anxiety spectrum disorder includes panic disorder, which means sudden onset of severe anxiety, agoraphobia, which means patient has difficulty to go out alone, like a public place like market or railway station or bus station. It includes specific phobia, which means it has phobia of specific space, like closed space, like heights, like blur. And last is generalized anxiety disorder, which means patient has a free floating anxiety without any apparent cause. Panic disorder, we would like to discuss. It includes recurrent attacks of severe anxiety, which is also called as panic, which is not restricted to any particular set or situations, and that is why it is unpredictable. The dominant symptoms of panic attack include sudden onset of severe palpitation, chest pain, choking sensation, dizziness, dryness of mouth, trembling or shaking, sweating, and abdominal discomfort. These symptoms usually last for 10 to 30 minutes. Then after, it will recover. However, anticipatory anxiety is very common in between the episode. These symptoms is always associated with secondary fear of dying, losing control, or going mad. Patient feels that they might have a brain stroke or a cardiac arrest. If this type of episode persists for more than 1 month, then we will call as a panic disorder. Then we would like to discuss about generalized anxiety disorder. Generalized anxiety disorder includes generalized and persistent anxiety, which is also called as a free-floating anxiety without any specific situations. It includes three elements. First element is apprehension, which means worry about future misfortune, feeling on the edge, and difficulty in concentration. Second element is motor tension, which includes restlessness, fidgeting, tension headache, trembling, and patient feels that he is unable to relax himself. The third element is autonomic overactivity, which leads to a light headedness, sweating, tachycardia, tachypnea means increased respiratory rate, epigastric discomfort, dizziness, and dryness mouth. If these symptoms persist for more than 6 months, then we will call as general anxiety disorder. It is very common in a middle-aged female. It requires treatment of antidepressant around 6 to 8 months. The third common disorder which is coming out is obsessive compulsive disorder. In this disorder, patient has a two component. One is obsession and second is a compulsion. Obsession means patient has repetitive, unpleasant thought, image, or impulses. If he see this condition in current scenario, then patient has a repeated thought that uh, their hands are dirty. So they have to wash their hand, which is called as a compulsion. Compulsion is nothing but motor or sometimes a non-motor part of the obsession. So if we see this condition in a current scenario, patient has a repeated thought that their hand are dirty in nature, so they have to wash their hand 2 to 3 times. Even after washing their hand for 2 to 3 times, they still have a thought that their hands are dirty in nature, so they have to wash their hand repeatedly. If these symptoms persist for more than 2 weeks, then it is called as obsessive compulsive disorder. This disorder requires treatment of antidepressant around 1 to 2 years along with the behavior therapy. Next disorder we would like to tell you is that post-traumatic stress disorder. It is delayed and protracted response to a stressful event or situations. In current scenario, this stressful event would be a long-standing stay in a hospital or seeing someone falling or collapsing in front of the patient's eye. So, after having these stressful situations, patient may have repeated flashbacks or dream. And while doing this flashback, patient's sense of numbness and emotional blunting. Surrounding people sees the patient as unresponsive to surrounding, and this flashback leads to avoidance of activities and situation which reminiscent of the trauma. Next disorder we would like to tell you is that psychotic spectrum disorder. It includes schizophrenia and external psychotic disorder, delusional disorder, and other disorder. Because of active states, there may be a chance that uh, a person would develop ATPD or worsening symptoms of schizophrenia. The symptoms of psychosis include suspiciousness, which means patients suspect that people are talking about the patient. Patient feels that people are planning and plotting against him. Patient also has muttering and gesticulating himself. Patient used to talk alone when nobody is around the patient. Patient also has aggressive abusive behavior without any evidence. These psychotic spectrum disorders require treatment of antipsychotic for at least 1 to 2 years. What are the psychosocial vulnerability? It means what people, the people who are at risk to develop psychiatric illnesses. So it includes adolescent, women, and geriatric population. It includes disabled people, psychiatric patients who have had psychiatric illness in the past, people with a chronic disease like diabetes mellitus and hypertension, people having People living in the poverty, migrants, and population groups, they have been victim of the virus. We have seen a lot of video in that people are building stone on the community response team and police. You can assume how much stress they must be having. Psychosocial vulnerability also includes patients suffering from COVID-19 infection and their family members because they have constant fear about the infection, and they also face stigma because of the COVID-19 infection. Psychosocial vulnerability also include member of institution and community response team. What happens is because of this lockdown, because of coronavirus, many of doctors and paramedical staff and police are not going to come at home because they have fear that their subclinical infection might infect to other family members. So this could be a part of stress, and this could be a part of psychosocial vulnerability. What are the etiological factors which is responsible for developing psychotic illnesses? It includes biological factors, social factor, and psychological factor. Biological factor includes physical health, genetic vulnerability, and drug effect. Physical health and mental health is interrelated. Genetic vulnerability means uh, person whose parents are having psychiatric illness are more vulnerable to develop psychiatric illness in the future. Drug effect means substance like alcohol, cannabis, opioids, and caffeine, which also leads to a psychiatric illnesses. Social factor means peer and family relationship and family circumstances. What happened during the lockdown? We cannot visit our friends, we cannot visit our close relatives because of that we have stress, and that can be a part of etiological factor. And the most important factor is psychological factor. It includes coping skill. It includes defense mechanism. In a simple defense mechanism means how the person would react to the stressful situation. Some people react in a mature way, some people react in an immature way. We will talk in detail about that in the later slide. So last, which is very necessary to hear, how to reduce step, what step we should take to reduce step. So the first step, you should remember that do not watch news of coronavirus repeatedly. It makes you more anxious and distressed. If you want to seek information or updates, then please visit government official site or WHO website. And this news you have to see for the specific time period, for the specific duration. Do not see this news for more than 30 minutes. Second thing, you should remember that do not spread rumor about coronavirus. Second and most important thing is time management. If you don't schedule your day, then your time will be spent without without you know how it has been spent. So it is very necessary to make schedule and follow that. This is a picture showing sarcasm, which means that I want to do time management as soon as I find a time to buy calendar. Uh, Maintain your physical health by doing regular exercise. Please do around 40 minutes of exercise every day, at least 5 days in a week. This is according to American Heart Association guidelines. Uh, During lockdown, you cannot go outside, but there are some application on the Google Play Store which you can download, and you can do Google. You can do home based exercise. What happens is because of exercise, your dopamine level in certain area of the brain would increase, and it helps to mitigate anxiety and symptoms of the depression. The exercise also reduce stress level in your body. So this is how the mental health and physical health are interrelated with each other. Another thing you have to do is please do regular yoga, meditation, or at least chant mantras. This helps to distract your mind. Along with that, you have to take adequate hour of sleep. You have to sleep around 6 to 8 hours. You have to take healthy food. ICE has given guidelines to take food to increase your immunity, to boost your immunity. So please read that. Till now, you have read a lot of about coronavirus. You have spent a lot of time on mobile. So let's cut down that time and manage this time to read something else. You can read mythological book or novel, depend on your interest. As everyone is suffering from stress in this period, do not displace or project your stress or anger to your near and dear ones. They are also suffering from the same stress. Please avoid using unhelpful coping strategy like tobacco, alcohol, or other drugs to reduce symptoms of anxiety or depression. It exacerbates your symptoms of anxiety and depression rather than decreasing it. So avoid these substances. So what are the mature way to handle stress? It includes altruism. Altruism, it means to do something for better for the opposite persons. So nowadays, protecting yourself is also a part of altruism. Do wear a mask, wash your hand repeatedly to stop spreading of the coronavirus, and to help the person who require your support. Anticipation is also a powerful method defense mechanism. What happened because of this lockdown, because of financial loss secondary to uh, stock market crash, you have to discuss these laws to your family and friend, and you have to make schedule how to reduce this stress. Sublimation is also a powerful method defense mechanism. It means you mitigate your anxiety and stress by writing something or doing exercise. Till now, in your life, you have faced many situations having a severe stress, and you use some strategy to fight that stressful situation, and you came successfully out. So this time is scenario is different, but the stress level is the same. So you can use those strategies which you used in the past to reduce this stress at this time. It is very important to connect with your friends and relatives with the social media. You can share your feelings and experiences to them. It helps to reduce anxiety, depression. Special care for old age population, older adult, especially those who are in isolation and with the cognitive decline and dementia are at risk to develop symptoms of anxiety and depression. Provide practical and emotional support through informal activities, uh, through informal network like families and health professionals would help them to reduce anxiety. A simple fact about what is going on surrounding and give clear information about how to reduce risk of infection in work or even in the posture will help them to understand easily. Special care has to take for children. Every children has his own way to express emotions during this time. It is common for children to seek more attachment and be more demanding parents. If your children ask for current scenario, then you have to explain in age appropriate manner so they can understand and their anxiety will be less. Uh, we have been uh, uh, we have been noticing that many of parents are complaining that their children are using social media, mobile very frequently. But you need to know that they are just copying what they are seeing. They are just imitating what they are seeing and hearing. So if children see that uh, adults around to her or him are doing or are using social media excessively, then they will follow those. So you have to do exercise or drawing or singing or some extracurricular activities in front of them, so the children can follow these activities. Uh, it is very important to keep children to their parents and family and avoid separating children and their caregiver. It is very possible that during this lockdown period, the child needs to be separated from his primary caregiver because of admission in a hospital, but please ensure appropriate alternative healthcare. During this separation, it is very necessary to video call or audio call them to mitigate the anxiety. What is the role of team leader? The role of team leader include to ensure good quality of communication between the team member and to pass accurate information to the all staff members. It is role of team leader to rotate worker from the high stress to low stress function, to initiate and encourage and monitor work breaks. It is role of team leader to implement flexible schedule for workers who are directly infected with the coronavirus or their family member impacted by stressful event. As a team member, you should know the mental health status of your client, and if your client have some mental health issue, you should know from where they can access psychological support. Till now, we have sent a lot of message about coronavirus. We used to send that yesterday this much case of coronavirus were positive, this much case were died because of the coronavirus. But rather doing that, uh, you can amplify the voice, positive story, and positive image of the local people who have experienced the new coronavirus and would recover, like when it has done. Say no to stigma, don't refer people with the disease at COVID-19 case, victim, or COVID-19 families or the disease. Rather than you can speak, people have coronavirus, people who are being treated for COVID-19, people who are recovered from COVID-19, because after recovering from the coronavirus, their life will go on with their jobs, families, and loved ones. Coronavirus has infected people from many countries in many geographical locations. Don't attach to it at any ethnicity or nationality. Be empathetic to those who got infected, as virus don't discriminate, neither should we. Spare good time with family and make it memorable. Thank you. This is a short poem which I have written few days back as a part of sublimation. Thank you. You can ask any question if you have.
Okay, Hardik, thanks for valuable information. Uh, the journey cannot ask the questions directly to us because they are already muted. Okay, but later on they will ask questions to my mail ID and I will forward to you. Okay, uh, you can give certain suggestions to maintain the physical mentality of the people. Okay, and how to get people or ill treated people have panic situation, so just give certain information about that.
The most important thing is do not see the news of coronavirus repeatedly. It makes you more anxious or more distressed. You have to do physical activities. You have to spare good time with your family member. Do engage with your friends by using the social medias. Do read. Thank you.
Hello.
Uh,
Yes, Hardik. One question is there from faculty. Is corona affect fruits and vegetables or other food products?
Yes, it can affect. For that, we have to wash fruit and vegetable vigorously. We have to keep these vegetables in water for at least 30 minutes. It should be a slightly a warm water.
Okay, so what should take care during this situation? Because currently we can see the graph is continuously growing upside. Okay, so in this situation, people are frustrated as well as they are feared with this infection. Okay, so what should they do during this situation to avoid the rumors or to avoid this infection?
Uh, the first thing you should know that do not spread rumor, do not use mobile excessively. If you want to see the updates about coronavirus, then visit official site like WHO website, like Government of India website. And when you go outside, please wear a mask. Please use a sanitizer repeatedly and make a social distance.
Okay. Uh, Thank you, Hardik. If you want to give certain information about the mental stability or regarding the psychiatric effects on minds because of this lockdown, okay. So if you want to give certain information about that, you can give the information to the people already joined us. Okay. Otherwise, we can complete here or this webinar. Hello.
Uh, that is all about. You have to do regular exercises. You have to read books. You have to make social attachment with using mobile sites, and do not read news of the coronavirus immediately. That is all about.
Okay, okay, okay. Okay, so thank you, Hardik, for very valuable information to all of these joined with us. Okay, and thank you from the Parul University to you to join with us and to give certain facts about coronavirus because there is so many rumors are spreading through illiterate people. Okay, so I hope the guys who attended the webinar they can find clear facts and how to avoid the rumors and be safe at our home. Okay, thank you all of you. Okay, now you can disconnect the webinar.